laser goes amazingly well with. That HVLA adjustment there we already talked about. It's great to have that laser done beforehand. It really helps kind of soften up those tissues, get you more blood flow in there. Makes the adjustment much, much easier on you and the patient. If you're using instrument techniques, I haven't really seen much difference between lasering before or lasering after. Either one's fine. If you're doing therapeutic exercise or physical therapy treatments, I do like to have laser done afterward. You can do it before, but sometimes when people are doing those therapeutic exercises, they tend to get a little bit irritated or look like, you want to be able to make sure that gets lasered after it gets irritated. So I like to do it afterward. You can do it before and you'll still see good results. You actually see improvements in strengthening if you do laser prior to exercise. People get stronger faster. That's very well established in the literature. But I like to do, if you're doing that in the office, I like to do laser after the TE. Ice and heat. I hate ice. I hate ice. I hate ice. I hate ice. Ice is great if you've got it for immediately post-acute injury, but ice slows down healing. It reduces blood flow to the area. It reduces anti-inflammatory effects being released into those tissues, so it reduces your results. It feels good, I know. Patients like it, I know, but it's going to actually slow down and make your results worse. The guy who came up with icing for injuries, Dr. Merkin, he came up with RICE, rest, ice, compress, and elevate. He came out a couple years ago and said, hey, look, guys, we should not be icing this much. It's been proven now that it slows down healing, so we've got to go back from icing. Ice will slow down the effects of laser. So if you have a patient who immediately goes home, signs an ice pack on the knee you just lasered, you're going to have greatly diminished treatment results. That goes to your troubleshooting on problematic patients. If you've got a patient who feels better right after treatment and they go right back to feeling the same way, are you icing? Are you using a heat pack? Because a heat pack's not quite as detrimental as ice, but a heat pack will increase swelling in the area. So generally, you want to have them stay away from that as well. Other topical things don't seem to matter that much. Icy hot, biofreeze, things like that, totally fine.
How about drinking water?
Oh man, yeah. Water's big, yeah, and we're gonna really dive into that when we talk about troubleshooting problematic patients. But yes, that's a big one. Ultrasound, therapeutic ultrasound. Did anybody do therapeutic ultrasound? Okay. I haven't really seen any difference between doing it before or after. If you've got a good protocol with ultrasound, see how that fits in with what you're doing. I can't find much information on when it should work, but I can't find a lot of information on how ultrasound is really supposed to work, or any major studies behind how it works and why it should be helpful. So shouldn't have any impact though on your laser success. I do not like massage. I don't like deep tissue massage in association with laser. It disrupts blood flow, and that's what we're going for with laser, of course, is trying to drive more blood flow to those damaged tissues. So if you're going to do massage, especially deep tissue massage, I recommend you do it before laser so that it doesn't have that kind of interruption of having your treated tissues getting massaged.